This video is basically going to respond to a comment that I had on one of my videos already. It says, "Greetings, Kalada. Hope you would be doing well. Would you suggest a female to pursue a career in psych or medicine, considering the work stress or working hours in the US?" That's a very good question. No career in medicine might be the best route. So there are many pros and cons to different jobs. Psychiatry, I have a whole nother video about the pros and cons of various psychiatric positions or fields. I think one thing to consider about being a psychiatrist is that it can be more emotionally draining or emotionally challenging than some other medical fields. People who, for example, are family medicine or internal medicine doctors, yeah, they see a lot of troublesome diseases and people suffering and things like that, but oftentimes they don't have to go into some of the details about trauma or abuse or just unfortunate life circumstances that a lot of people who are suffering from mental health conditions have gone through. So basically, as a psychiatrist, you're basically this container for these negative emotions or resentments or bitterness. And so when the patients talk to you about that, that can sort of be overwhelming, or you might have to sort of process that in a good and healthy way. That could be why way I try to really get close to my faith or religion, because, you know, as a human, there's only so much possibility I have to process that. I have to give it up to God. But similarly, I think a lot of people have their own gifts and strengths and talents that, you know, God has empowered them with or can empower them with, so that they can use those skills to better whatever they want to do. I have some doctors in, you know, my family that are internal medicine and primary care, neurology. Each field is going to have its own demands. For example, a surgeon often has to be on call to be ready for emergencies, whether it be a general surgeon, whether it be maybe an ophthalmologist. There's a GI doctor also has to be prepared to perhaps be on call if there's a bleed that they have to attend to late at night. So you might want to consider those things. I don't think more necessarily whether you're male or female, but how much you think you can tolerate, like being woken up at night or having always to be prepared to rush to an emergency room or handle a call any hours of the day. You know, fields like psychiatry doesn't have too many emergencies, so that is something to take into account. But if you can't handle this emotional trauma or emotional stories that you may hear on a daily basis multiple times a day, then maybe that's not the field for you. You could be a dermatologist, which also doesn't have too many emergencies, but dermatology is super competitive, and unless you are one of the top-notch students in the United States, that may not be practical. You could do something perhaps like related to genetics or nuclear medicine. Those are some ways to maybe not have as much stress. Maybe a radiologist maybe doesn't have to deal with as much patient care directly. So whenever you have patient care, unfortunately, it can be a bit stressful. Patients have their own issues. You have to think, you have to sort of plan. They may not like what your recommendations are, even if that's what's best for them. So you have to kind of prepare for those things. You know, I don't know if it's going to be possible to really prepare fully for what the demands of a job entails. Sure, psychiatry is not as like stressful as like neurosurgery. Neurosurgery, you have maybe long operating room hours. You have to always be on call, be prepared. So I think more than the job itself, it's probably best to really understand what you're good at, what your gifts are, or what your talents are, what you could see yourself like doing. Hopefully that helps to answer the question. Also, I think if I was a female going to medicine basically and have a job opportunity, definitely try to maximize, I think I'd want to maximize the maternal aspect of it. So a job that is open to you having children and taking time off to, you know, care for your family or raise your children. That seems really great. Some settings may not be as easy or flexible with that as others. Those are just my 2 cents. I definitely wouldn't take it as gospel, although I have had some experience dealing with healthcare, with family members being in it, and knowing a few other people who are in it as well. So hopefully that helps to sort of get some clarity or understanding of how I think, you know, would be good to proceed.